Dear learners, welcome to Module 1 of Communicable Diseases. I am Professor Swati Rajput from Department of Geography, Shaheed Bhagat Singh College, University of Delhi, and author of the book Geography of Health by Concept Publication. The objectives of this module are to understand the meaning and concept of communicable disease. We would also be examining historical facts by tracing the emergence of communicable diseases in the world. Also, to categorize the type of communicable diseases based on their cause and agent. We will learn the meaning of spatial epidemiology. The module would also identify the spatial trends and patterns of communicable diseases in the world. Let us first understand the meaning of communicable diseases. Learners, a communicable disease is also known as infectious disease or transmissible disease is an illness that spreads from one person to another person or from animal to a person or from a surface or food. Communicable diseases are caused by pathogenic disease-causing biologic agents that infect, grow, and are present in human or animal host. Infections can range from a symptomatic, that is, without symptoms, to severe and fatal. The term infection does not have the same meaning as infectious disease because some infections do not cause illness in an host. Diseases like influenza, smallpox, leprosy, malaria, and tuberculosis are some examples of communicable diseases. So how does these diseases spread? Well, these diseases can spread easily in environment with high population density, poor sanitation, with people with malnutrition and inadequate healthcare facilities. How these diseases spread depends on specific disease or infectious agent. Some ways in which communicable diseases spread are by number 1, physical contact with an infected person such as through touch, sexual intercourse, fecal or oral transmission or droplets. Number 2, contact with a contaminated surface or object, food, blood or water. Bites from insects or animals are also capable of transmitting the disease. Next is respiratory infections that travel through air are also responsible for communicable diseases such as tuberculosis and measles. And last is zoonotic diseases, the ones that travel from animals to humans like rabies. Let us now understand some facts and chronology of such diseases in the world. Not to forget that centuries back there was no technology for identifying, curing or curtailing the disease, spread of communicable disease. Plague of Athens, this is the first recorded pandemic, occurred during Peloponnesian War in Athens, Greece in 430 BC. The disease was carried across Athenian walls during the siege. Historians estimate around 2/3 of the population died from contracting to these diseases. Then came Antonine Plague. It was the first recorded pandemic to affect the Roman Empire. The Antonine Plague that lasted for 165 to 180 AD was presumably infected and spread by troops who were coming from a campaign to Near East, although measles has also been considered by most scholars believe that smallpox was the cause of the pandemic. Most of us have heard about Black Death, the bubonic plague epidemic known as the Black Death, often referred to as pestilence, the great mortality or plague, struck Western Eurasia and North Africa between 1346 and 1353. The height of the pandemic, which claimed 75 to 200 million lives and peaked in Europe between 1347 to 1351, is considered to be the deadliest in recorded human history. The bacterium Yersinia pestis, which causes bubonic plague and is spread by fleas, also likely caused pneumonic plague that affects lungs during the Black Death by spreading via aerosols from person to person. Syphilis. Syphilis can spread through blood transfusion, oral, vaginal and anal intercourse as well as during pregnancy. Pregnancy-related syphilis increases the risk of stillbirth, neonatal deaths and syphilis in newborns. Rui Diaz, a physician and founder of syphilography, accepts syphilis as unknown disease, so far not seen and never described, that began in Barcelona in 1493 and originated at Espaula Island. Syphilis was first discovered on Espaula Island in the Galapagos Island. It is believed Pinzon de Columbus, pilot and other crew members were already suffering from syphilis when they returned from the New World. Later, the first cholera pandemic, also known as first Asiatic cholera pandemic or Asiatic cholera, originated close to the city of Calcutta and spread over South and Southeast Asia to Middle East, Eastern Africa and Mediterranean coast. It lasted from 1817 to 1824. In centuries past, infections including nausea and vomiting were referred to as cholera. Today, the term cholera refers particularly to diseases brought by Vibrio cholerae bacteria. Next is influenza, that is Spanish flu. The influenza virus, which spread by respiratory droplets generated when an infected person coughs, sneezes or talks, is responsible for influenza, a contagious respiratory illness. The 1918 flu pandemic, sometimes referred to as Great Influenza Pandemic, epidemic or the Spanish flu, because to its widespread misconception was a particularly lethal worldwide influenza pandemic brought by H1N1 influenza A virus. The United States of Canas reported the first case in March 1918. In April, cases were also reported from France, Germany and United Kingdoms. 2 years later, 4 subsequent waves of infection had affected 500 million people worldwide, or close to 1/3 of the world's population. Death tolls estimates range from 17 million to 50 million. Next is the horrifying stories of AIDS that begin in 1980s. Beginning in January 1981, medical professionals in Los Angeles, New York and San Francisco all reported the some of the gay male patients had odd symptoms. Immune system health was affected in all the individuals. Since the bizarre new illness mainly affected gay males, it was initially claimed gay cancer. Researchers identified the disease causing virus known as human immunodeficiency virus 2 years into the epidemic, but it took another 2 years for the first HIV test to be approved for the use in the United States. By that time, the illness had claimed the lives of nearly 9,000 people, with half of them already deceased. LGBT and bisexual men made almost 70% of the cases that were officially reported, and the epidemic created havoc on LGBT community. COVID-19, since its breakout in 2019, COVID-19 respiratory infectious disease brought on by SARS-CoV-2 virus has expanded quickly throughout the world. Respiratory droplets, surfaces and close contact with sick people are all routes by which the disease is spread. Johns Hopkins University medicines report that there were been 3.8 million fatalities and 177 million documented cases worldwide. Now, before we proceed further to understand the pattern and trends, let's talk about spatial epidemiology. Spatial epidemiology is a description and analysis of geographic variations in disease with respect to demographic, environmental, behavioral, socio-economic, genetic and infectious risk factors. Advances in geographic information system, statistical methodology and availability of high resolution geographically referenced health and environmental quality data have created unprecedented new opportunities to investigate environmental and other factors in explaining local geographic conditions variations in disease. So learners, spatial epidemiology is the description and analysis of geographically indexed health data with respect to demographic, environmental, behavioral, socio-economic, genetic and infectious risk factors. It is a part of long tradition of geographic analysis dating back to 1800s when maps of disease rates in different countries begin to emerge to characterize the spread and possible causes of outbreak of infectious diseases such as yellow fever and cholera. Spatial epidemiology extends the rich tradition of ecological studies that use explanations of distribution of diseases in different places to better understand the etiology of diseases. Let us now look at the framework of spatial epidemiology. In considering an analytic framework for spatial epidemiology analysis, we first distinguish between point and area data. Each of the population, environmental exposure and health data may be associated with a point or exact spatial location such as street, address, occurrence data, or an area, a defined spatial region such as community of which it is representative, or aggregate summaries. Data from a variety of points, example residence, workplace, hobby locations, may give the closest link to an assumed biologic model in which average disease risk of an individual will reflect individual characteristics such as age, sex and genetic factors, lifestyle variables such as smoking and diet, and exposure to environmental pollutants. The lifestyle and exposure factors may depend on ways that individual interacts with the environment as he or she moves through both time and space, which itself depends on the range of daily activities, types and location of residence, workplace, travel and migration patterns, habits, behaviors, and so on. Spatial epidemiology inquiry can be divided into three main areas which geographers are mainly interested in and can contribute to their research. First is disease mapping and gathering of georeference data to depict the prevalence of disease in time and space. It uses geographic information system that permits storage, analysis and presentation of multidimensional data. Second is geographic correlation studies, seeks to determine how health is influenced by geographic factors. Geographical investigations of the spatial variation of disease provide important insights into what contributes to disease outcome and options for disease prevention. Third is clustering disease clusters and surveillance. The investigation of clusters may be best viewed as a form of public health surveillance, that is, ongoing collection and analysis of dissemination of information important to public health practice that responds to community needs. It is not necessarily a primary mechanism for investigating the etiology relationship. Now let's examine the prevalence of communicable diseases or infectious diseases in the world. The data shows that the highest death due to infectious diseases is in part of Somalia and Central Africa, Zimbabwe and Bolivia. Deaths are high between 200 to 1000 per 1 lakh, mainly in South Asia, Central and Southern Africa. Communicable diseases have been almost eradicated from the developed countries like Canada, China, Australia and Scandinavian countries. Let's first talk about respiratory diseases. Flu or influenza. Influenza is highly infectious respiratory illness caused by influenza virus. Seasonal influenza is characterized by sudden onset of fever, cough, usually dry, headache, muscle and joint pain, severe malaise, feeling unwell, sore throat and a running nose and sometimes the lungs, leading to range of symptoms from mild to severe. Some prominent examples are the Great Influenza Pandemic. As mentioned earlier, it was the most devastating flu pandemic in history, known as Spanish flu. Killed millions of people worldwide, including an estimated of 5 lakh people in United States. The pandemic originated in military camps and trenches during World War I and affected more than 1/3 of world's population. The Asian flu pandemic, that was from 1957 to 58, the pandemic began in China and quickly spread to Southeast Asia, Hong Kong and United States. The Asian flu resulted in the deaths of approximately 1.1 million people, including 1,16,000 Americans. The Hong Kong flu pandemic. This was from 1968 to 69. The Hong Kong flu originated in China and quickly spread to Europe and United States. The pandemic claimed approximately 1 million lives globally and caused over 1 lakh deaths in United States. Then came the swine flu, that is pandemic 2019 to 10, which is also known as H1N1 virus, was first detected in Mexico and caused a pandemic that spread to United States and other countries. It is estimated that the swine flu caused approximately 2,84,000 deaths worldwide, including an estimated of 12,000 in United States alone. Next is the COVID-19 pandemic, and it is still ongoing. COVID-19, caused by SARS-CoV-2 virus, is a respiratory illness that had turned into a global pandemic. The disease was first identified in Wuhan, China in December 2019. It quickly spread across the globe and has since caused millions of deaths worldwide. According to American Institute for Economic Research, the two primary theories of origin of SARS-CoV-2 are natural transmission from animal to human, also known as zoonotic transmission, and manipulation in a virus laboratory, most likely the Wuhan Institute of Virology, that is WIV. Both theories have merit, neither has been proven or disproven. Understanding deaths due to COVID-19 in data shows highest number of deaths due to COVID-19 happened in US, Brazil, India, Russia and Mexico. Lowest happened in the countries like Bhutan, Monaco, Dominica, Central African Republic, etc. Countries with high density of population suffers most, especially the cities and the towns. Dear learners, now let us examine food and waterborne diseases. According to WHO, over 200 diseases are caused by eating food and contaminated with bacteria, viruses, parasites or chemical substances such as heavy metals. Waterborne diseases are illness caused by microscopic organisms like viruses and bacteria that are ingested through contaminated water or by coming in contact with feces, like typhoid. Typhoid is well known in extremely poor countries, poor parts of developing countries. It is estimated that up to 20 million people worldwide suffer from the illness each year. Let us discuss cholera. Cholera is an infectious disease that affects the small intestine caused by bacterium Vibrio cholerae. It is an acute diarrheal infection caused by ingestion of contaminated food and water. First cholera pandemic, the earliest known pandemic of cholera, began in 1817 in India and then spread to Southeast Asia and Middle East and Africa. It claimed 117 million of lives and ultimately reached as far as Europe, North America and South America by 1832. Second cholera pandemic started in India and then spread to Europe, Middle East and Africa. The outbreak claimed millions of lives, including prominent people such as infant son Queen Victoria in Britain. The third cholera pandemic started in India and then spread through trade routes to the rest of the Asia, Middle East, Africa, Europe and America. This pandemic reached its peak between 1852 to 1855 and claimed over 1 million lives in India alone. Fourth cholera pandemic, that is from 1863 to 75, began in Ganges Delta near Calcutta and quickly spread to other parts of Asia, Middle East, Africa, Europe and America. The pandemic claimed the lives of approximately 2 lakh people in Spain and 90,000 in Japan. Fifth cholera pandemic, this pandemic began in Bengal, India and then it spread to Southeast Asia and Middle East and Africa. It caused death of hundreds of thousands of people worldwide. Sixth cholera pandemic, this pandemic began in India again and then spread to other parts of the countries through trade routes. By the end of the 19th century, cholera had become an epidemic in parts of Africa and Asia. Seventh cholera pandemic, this pandemic began in Indonesia and spread to other parts of Asia, Middle East and Africa. WHO reported approximately 1.3 million cases of cholera in 2018 alone. In context to the deaths due to cholera, world data shows that cholera cases have been recorded high in Pakistan and Arabian and South Asian countries. Cases recorded are low in China, Iran, eastern states of Africa. Cholera deaths are high in Cameroon, Syria, Malawi, etc. It reflects that medical facilities available in these countries are below the required parameters. Moreover, unhygienic conditions and poor sanitation facilities and unsafe drinking water, contaminated food, and other such reasons for high cases of deaths. Another type of communicable diseases is arthropod or vector-borne diseases. These diseases refer to infectious disease that are transmitted from an infected organism to a human host by a vector such as mosquito, flies, ticks or rodents. Here is a brief chronological history of the occurrence of vector-borne diseases in the world. Malaria. Malaria is one of the oldest infectious disease and has been present for thousands of years, recorded in ancient Chinese medical and in ancient Egypt text. These diseases is transmitted by the Anopheles mosquito and continues to be a significant health burden, especially in Africa. Yellow fever. Yellow fever emerged as a significant infectious disease in 17th century during the slave trade from Africa to America. The virus is transmitted by Aedes or Haemococcus mosquito that bite humans and non-human primates. A vaccine against yellow fever became available in 1930s. Plague. Plague caused by bacterium Yersinia pestis is transmitted by fleas that feed on infected rodents. The disease caused three major pandemics throughout the history: the Justinian plague, the Black Death and the third pandemic. The disease is still present in some parts of the world and is treatable with antibiotics. Zika virus disease, that is from 1947, it's ongoing. The Zika virus causes a mosquito-borne illness that emerged in Zika forest in Uganda. In 2015, an outbreak occurred in Brazil and eventually spread to the other countries worldwide. The virus is transmitted by Aedes mosquito, which also transmit dengue, chikungunya viruses. West Nile viruses, from 1999 it is also ongoing. West Nile virus is transmitted to humans through the bites of infected mosquitoes. It was first detected in Uganda in 1937 but was identified in United States in 1999. The virus has since been reported in many countries and can cause neurological diseases in humans. Let's talk about malaria. Malaria is the disease often associated with marshy regions and was once considered to be the cause of bad air or miasma. The Roman writer Celsus later called it quartan fever due to its reoccurring pattern every fourth day. Scientists at the University of Rome have found evidences showing that malaria came from Africa, underwent mutation and was introduced in marshy and mosquito-infected Tiber River basin by 5th century. Dr. Frank Romer, a Roman historian at Arizona, noted accounts of pestilence spreading through the countryside at this time and causing sweats and chills, symptoms typical to malaria. Malaria has had a significant impact on human history and continues to be a major public health concern today. Malaria is prevalent in sub-Saharan Africa but is also found in parts of Asia, Latin America and Middle East. Nearly 40% of the population of Southeast Asian regions reside in malaria-prone region. Although malaria was once present in many parts of the world, it has now been largely eradicated in North America and Europe. According to World Malaria Report 2022, the African region continues to shoulder the heaviest burden of malaria. Globally in 2021, the region accounted for 95% of the malaria cases, 96% of all malaria deaths and nearly 80% of all malaria deaths were among children under the age of 5 years. Malaria cases are very high in Democratic Republic of Congo, Nigeria, Niger, Mali, etc. Mostly Central Africa, Almost negligible cases are found in Asian, European and American countries. Malaria is more prevalent in tropical regions, tropical countries with heavy rainfall, but in many countries the disease is controlled by taking precautions and medicines. Let us now talk about sexually transmitted diseases. Sexually transmitted diseases have been prevalent throughout the history. STDs are caused by microorganisms that reside on human skin or in body fluids like blood, semen or vaginal fluids. When these microorganisms are transmitted from an infected individual to a healthy person, they can result in illness. According to WHO, more than 1 million sexually transmitted infections are acquired every day worldwide, the majority of which are asymptomatic. According to WHO, each year there are an estimated of 374 million new infections with 1 of 4 curable STIs. When used correctly and consistently, condoms offer one of the most effective methods of protection against STIs and including HIV. Dear learners, HIV/AIDS, which means human immunodeficiency virus infection, and acquired immunodeficiency syndrome is one of the most fatal STI. According to WHO, there are 2 types of viruses in this category. One is HIV-1 and the other is HIV-2. Out of these, HIV-1 is very lethal and is widespread in Asia, Europe, Africa and American continents. Considering HIV-2, it is mainly found in West Africa and is similar to the virus found in monkeys. The prevalence of HIV/AIDS varies significantly around the world, and sub-Saharan Africa has the highest number of HIV/AIDS cases. But the diseases is also prevalent in certain parts of Asia, Eastern Europe and North America. Now, this is due to variety of factors including access to healthcare, education, prevention methods and rates of high risk behaviors. According to global HIV statistics, 38.4 million people globally were living with HIV in 2021. AIDS-related diseases have been reduced by 68% since the peak in 2004 and by 52% since 2010. The contact-based disease is more prevalent in African continent. The cases are high in America. It is mainly because it originated in Africa and mainly reached America due to slave trade. The Eastern Mediterranean and Australia and China record less cases. Dear learners, the next category is about zoonotic diseases. A zoonotic disease is a disease or an infection that can be transmitted naturally from vertebrate animals to humans or from humans to vertebrate animals. Now, more than 60% of the human pathogens are zoonotic in origin. This includes a variety of bacteria, viruses, fungi, protozoa, parasites and pathogens. Factors such as climate change, urbanization, animal migration and trade, travel and tourism, vector biology, anthropogenic factors and natural factors have greatly influenced the emergence and re-emergence, distribution and patterns of zoonosis. The disease are more common in rural areas where people come in direct contact with the animal like cattle, horse, pigs, goats, etc. Maybe during the agricultural practices. One of such diseases is rabies. Now, rabies is caused by a virus that spreads by an infected animal biting to another animal or person. It is a disease that affects the nervous system of mammals. Rabies has clinically 2 forms: furious rabies characterized by hyperactivity and hallucinations, and paralytic rabies characterized by paralysis and coma. According to WHO, rabies is estimated to cause 59,000 human deaths annually in over 150 countries, with 95% of cases occurring in Africa and Asia. Due to underreporting and uncertain estimates, this number is likely a gross underestimate. The burden of disease is proportionally borne by rural poor populations, with approximately half of cases attributable to children under the age of 15 years. Interestingly, rabies is present in all the countries leaving aside Antarctica. Around 95% of deaths due to rabies occur in Asia and Africa. It basically impacts vulnerable and poor sections of society. Rabies is mainly found in North and Central Africa and Asia. Moderate risk of rabies is in South America and Central America and Russia. It is almost negligible in North America, Canada and Australia. Rabies can be controlled by vaccination in many countries. Due to lack of medical facilities, the rabies cases are very high in Africa and Asia. Now to summarize, let us just summarize the entire module. Number one, we have focused on that communicable diseases can spread due to contaminated food and water, contact, vectors or animals, or mere respiration. History of communicable diseases can be traced back from origin of plague in 430 BC to COVID-19 till date. Spatial epidemiology is the description and analysis of geographic variations in disease with respect to demographic, environmental, behavioral, socioeconomic, genetic and infectious risk factors. Highest death due to infectious diseases is in the parts of Somalia and Central Africa, Zimbabwe and Bolivia. Recently, highest number of deaths due to COVID-19 happened in US, Brazil, India, Russia, Mexico. Countries with high density of population suffer the most, especially the people living in cities and towns. Thank you so much.